Celebrating the baby boomer lifestyle. This is Boomer Life with Sterling Fox on AM 650.
Welcome back to the program. We're talking with the professionals from Integrative Naturopathic Medical Center. There are actually 30 of them there. We have 2 in studio in the persons of Dr. Larry Chan and Dr. Alex Chan, naturopathic physicians both. And we're talking about all of the services and provided programs provided by the center. Alex, you've done a terrific job of running us through many of them. Larry, you're going to talk about the pain management program. This is living with chronic pain is just absolutely no fun at all, and people are looking for non-pharmaceutical ways to manage pain because you take too many drugs and you turn into a zombie. And how much fun is that? Not much. What do you do?
Well, pain and inflammation is ongoing, and it just gets worse as we age as well, unfortunately. Arthritis, age-old injuries that have just multiplied over the years.
The old football knee and all that, yeah.
There's also metabolic pain caused by disease and illness that create pain as well.
Mm-hmm.
So how do we deal with that? In our clinic, we really look at the bodies, again, the whole body, where the person's strengths and weaknesses are. And we look at the terrain, back to the terrain. Is the body too acidic? Acidity, low oxygen states can produce a lot of inflammation.
Okay.
And if we can get the body by analyzing the blood, urine, and saliva, seeing what their status of their terrain is, we can then make some alterations from a nutritional standpoint, or we can use intravenous in our lab interventions to balance their terrain and balance their acid base. And that could be a tremendous change in pain, a long-term change.
Because the lower the acidity in your body, the less inflamed your body is, right?
If your connective tissue is inflamed, it will spur on arthritis, inflammation, and even inflammation can spur on degenerative diseases like cancers and heart disease and things like that as well. So all that's linked in. So in other ways we deal with pain in our office, we do a lot of, we have a chiropractor who's fantastic at dealing with pain. He has lasers. He works with manipulation, postural balancing, fantastic with that. Our traditional Chinese doctor with acupuncture is fantastic treatments for pain as well.
Mm-hmm.
Just balancing the meridians, balancing imbalances in energy flow, but also in structural alignment. You can use needles for that, balancing muscular problems.
Nutrition to help weight loss, which has caused a lot more pain and stress on the joints.
Well, that's true. If you're carrying around 20 or 30 extra pounds and you're already dealing with a chronic inflamed situation like arthritis or rheumatism, that extra weight is really not helping anything, and it's making life even more painful.
The weight can represent also more possibilities of inflammation because you're carrying not just weight but toxins as well.
Right.
So that toxins add to inflammation. So all those things are linked in. So treating pain with just painkillers pharmaceutically is just one small symptomatic relief. You want to get to the cause of it. And other things we do that can help with, we have massage therapists as well. We've mentioned that before.
Right,
we can help with postural alignment and pain that way. But we also do a lot of leading edge therapies with regenerative injection therapies. So let's say chronic hip problems or knee problems or shoulder problems may be really a function of disc and ligament problems that are occurring. And if they occur and have dysfunction and pain, injection therapies can be it's almost miraculous what you can do in terms of restoration and rebuilding.
And what sort of compound would be injected? Would it be something synthetic?
We mostly inject, we can inject things like sugars. We use dextrose mannitol it's great for pain relief, something called neuroprolotherapy, to strengthen ligaments or disc in the back for back pain.
Mm-hmm.
Prolotherapy is fantastic. It's using mostly dextrose and procaine, very safe natural elements. And also we use more enhanced treatments. We use PRP, which is blood platelet injections. We actually take blood from the person, extract the platelets, which is really a rich growth factor, inject that back into the injured area, and the healing is pretty fantastic.
Wasn't that some kind of a controversy back in the bicycle racing field a few years ago?
That's blood doping.
That's blood doping. But is it similar?
It's different.
I'm sorry. I just heard your explanation, and I'm thinking, Lance Armstrong, what's going on here?
Well, that's a very typical assumption because you're using blood, but they're putting it back in hemoglobin to increase the amount of cells
so that he can have more oxygen and then he can have more athletic performance.
Right.
So this is where we're taking the blood platelets and injecting right into the joint or ligament areas to help regrowth and rebuilding and restructuring of the area.
So some inflammatory type conditions, Dr. Alex, can they be cured with appropriate treatment? I mean, if you have arthritis and you're kind of in your 60s, you sort of have you resign yourself to a less than perfect quality of life because I'm getting old and I got these little aches and pains. Can they be made to go away or just stuck with them?
So usually what we're talking about in this case is something like osteoarthritis rather than rheumatoid arthritis, or what you're talking about is where there's an old injury. So you might have an old injury which caused some instability in a particular joint. Like a lot of people have knee injuries.
Yeah,
right?
yeah.
And it might not
especially
be
us skiers.
Yeah, it might not be a total tear or a degeneration of the ligament, but there's a lot of structures. Basically, the ligaments are what holds everything together. They hold the muscle and the bone together. In order for those to repair, it's really difficult because they don't get a very good blood supply. And so that initial, when you make the injury, you have an initial inflammatory response, and that's basically the one shot. You've got to heal it. With a lot of the regenerative injection techniques that we're doing, we're basically creating a mini inflammatory response in a helpful way in that area so that we're able to stimulate the body to regrow new ligament and new tissue. And all of that, I think you asked whether it's synthetic or not. No, usually we're not using synthetics. It's usually physiological concentrations of dextrose or platelets that are coming from your own body system.
Right.
So yeah, that's a big program for us and a lot of that we do for a lot of pain management.
Well, it's kind of cool, Larry, that you get to use your own system to heal yourself. Isn't it? It sounds actually kind of inexpensive too.
Well, that's a beautiful way of doing it. And the other thing is something as gout. Gout is so common.
My dad had gout. Yeah.
And people take gout and it gets worse as the years go on as you get older. Well, we can help that completely eradicate by just looking at your inflammation, your acid-base balance.
Is that right?
Yes.
Gout can be completely managed.
Yes, it's very, very treatable. But you have to look at the whole body from that standpoint.
Okay, so and now we've had an opportunity to go through the process of what it would be like to become a patient at Integrative Naturopathic Medical Center. It sounds like a pretty welcoming, warm environment, Alex.
Yeah, I think that's what we really strive towards. We're really wanting to meet every person where they're at. So, everyone has a different set of goals when they come in the door, and everyone knows the things that they maybe could have done better, could have done differently, but it's not about that. It's about the fact that they're taking that initial step to show up to the office. They're showing that they're interested and they're motivated.
Right.
And we really want to do everything we can to support that process.
That's right.
And just move forward.
If they go to all the trouble of getting on the bus or whatever and heading down to 1285 West Broadway, and they're maybe a little out of shape or they're maybe experiencing some difficulties, they're still putting themselves in the crosshairs, Larry, for you and your team to look at. Last thing they want is a lecture, right?
Absolutely. Everybody's story is important to themselves, and it's important to us to help them to listen to that story.
Right.
And that's critically important. So every story is important.
Treat every person as an individual and give them as much time as you can.
And meet them where they're at so that we can move forward in whatever the best way is for that person, right? And be able to support their process.
The best way to find out about Integrative Naturopathic Medical Center and to make the all-important first phone call is go to the website. All the programs that we've discussed here at some length are listed at greater length on the website, as well, of course, of all the contact points, the phone numbers, emails, etc. Integrative.ca. Dr. Alex Chan, lovely to see you again.
Nice
Thanks for
to see you
coming
too.
by. Dr. Larry, take good care of yourself, and we'll see you again soon, too, I hope.
My pleasure. Thank you.
That's it for Boomer Life this time around, friends. See you next time.